Welcome back to Face the Nation. We now go to the head of America's second largest bank, Bank of America CEO Brian Moynihan. Good to have you with us again.
It's good to be here, Margaret. Good to see you again.
May 1st is Friday. That means a lot of bills are coming due for Americans, including mortgage payments. Last time you were with us, you said customers can call and defer those payments. How long is that going to be sustainable for?
Well, Margaret, I think let's back up. It was 5 weeks or so when we were together, and you have to think about the themes that we were talking about then. Number one, there was only 3,000 cases in the United States, so think about the difference in numbers of cases. The social distancing and shutdowns weren't in place yet, but we knew they were coming. Importantly, we talked then about the need to win the healthcare battle, win the war against the virus, and it took all people to do it. And what you've seen is our industry actually helped the way it was supposed to. And so whether it's through the regular way lending we all did in the first quarter, which is $500 billion, including for us $70 billion and $2 billion of small businesses, whether it's the work we did through the customer assistance program that you're referring to. The whole industry has adopted similar things. We have 1.25 million customers, 1.25 million customers are asked for a deferral of payments, and that will continue to go on for the near future and into the fall. And then on top of that, we also have engaged in the government programs that you've been speaking about with the various of your guests, whether it's the PPP, which $300 billion went out. The program's only 3 weeks old, and another $300 billion scheduled to go out, and we're ready to go on Monday. Or whether it's the checks that have been issued to people, which we're cashing for no fees at all our branches, even if the person's not a customer. And we're also helping those our customers get the money in their account, and we're not charging them any fees or anything, letting all the $1,200 go out to them. Or in the work we do in society writ large, which is to help our teammates be safe, and in our communities for $100 million of charitable giving and our $350 million of community development financial institutions.
Well, I want to ask you specifically about the small business program you just mentioned. That money was really quickly depleted. There's a new round that Congress put together with the White House. It goes into effect as soon as tomorrow. When will Bank of America get that money out the door? And will small mom and pop shops have a better chance at getting some of that money than they did last time when some larger firms kind of jumped to the front of the line?
Well, that money in our case, the first piece is pretty much all out the door, and it went largely to small businesses. If you think about the statistics of who we're going to put in the process next, 80% of business have less than 10 employees total. 95% have less than 100 employees. These are small businesses. We have several 100,000 to go in, and as long as the program continues to be funded, all those people will get funded. The difference between this program and unemployment is if you qualify for this program, it's like getting your unemployment authorization and then have to win a foot race to the office. We need to take away the first come, first serve aspects of this and make sure it's fully funded, because at the end of the day, it's going to where people want it. Small businesses, 25% in our case of businesses in low and moderate income neighborhoods, businesses with small numbers of employees, and we just have to finish the funding and finish the work. And we have thousands of teammates that have been working for the last 3 weeks to help with our hundreds of thousands of applications.
Is that money already tapped out?
Well, the first batch is,
right.
And then some of it will be recycled.
In 2 weeks, the first batch is because of the demand. Right. Is the money that's been allocated this time, do you already have more applications than expected?
Well, we don't. I mean, our portion is roughly around $50 billion applications, and we'll push those through. Not all those get funded because some of them withdraw and things like that. But I think there's a great debate about how much this will ultimately take. But this is another healthy piece that we'll put to work. And I think it's clear that between Congress and the administration and American people, we need to get all these funded and not make this a foot race. Just get the work done and get everybody through. And the work has to be done in a way that supports American taxpayers who ultimately pay for this, and also gets the small business the money and has them pay their employees, which is the goal of the program.
So when we spoke 5 weeks ago, as we mentioned, it was a different environment. Since that time, your analysts at Bank of America have changed some of their own projections. Now the prediction is 16 to 20 million jobs could be cut in this country. The recession is going to be deeper and much more prolonged than initially expected. So those job cuts, if we're at around 16% unemployment right now, which is what the White House says we're likely at, do you believe we are now at the peak of this?
Well, I think there's two things to think about. First of all, the base assumptions for that 5 weeks ago changed pretty dramatically. There was sort of a low growth U.S. Now it's a negative 6% in our case, our experts' estimates, and plus 6% in 21. But the key is to understand the quarterly flow of that. So it's a deep recessionary environment in the second quarter, a less deep in the third quarter, and then growth in the fourth quarter. So it's minus 30, minus 9, plus 30 on an annualized basis, and then grows next year double digits and works its way down to single digits. So in effect, that's one thing to think about. Is this a deep recession and back out? And there's great debate about how that works, but our estimates, our experts think it's late next year when the economy gets back to the same size it was prior to this. What we see in our consumer spending is kind of interesting, and it reflects this question of unemployment and cash flow in a household, because so far the spending by our consumers, if you took from January to this week, it's actually flat to last year. But obviously, that's a tale of two pieces of time. First, it was plus 10, and then it went down about 25%, and it's leveled off there. So the month of April is down about 25%, but it's leveled off, and it's starting now to grow in certain areas, especially as you see it kind of hit bottom. So one of your earlier guests is in the entertainment business. That's still very far down, but other businesses are starting to come on after the first round of provision buying, which was a flood of activity. You're now seeing that level out. That actually provides some hope that as the economy opens up in pieces and safely, you'll see that consumer spending continue to grow, which will help fuel the U.S. economy. And so that's the second piece to keep aware of is first the economic projections, but secondly, the cash flow and the stimulus, the PPP, the unemployment, the $1,200 EIP payments, all those things are going in the economy, and we're starting to see the effect of those.
All right. Brian Moynihan, thank you very much. We'll be back in a moment.
Thank you, Margaret.
We go now to San Francisco, the first metro area to issue a shelter-in-place order. That city now on day 41, and the order may be extended past early May. We're joined now by Mayor London Breed. Good morning to you, Mayor.
Good morning.
As we said, San Francisco acted first. We also know you have also since mandated masks being worn. I'm wondering, what is it that you are seeing that other leaders around the country have not?
Well, I think the biggest challenge we have is we need to make sure that we are looking at the facts and the data from our public health experts so that we can make good decisions to protect public health. The challenges that we face still around PPE, around testing kits, is just absolutely insane. We have known that this crisis was coming to our country for a long time now. And the fact that as of April, we're still having the same conversations about the challenges, I know that most cities are seeing the same data I'm seeing, that if we do absolutely nothing, it gets worse. And so that's really why we have been really a lot more aggressive maybe than other areas, because we wanted to make sure that it doesn't. When you think about San Francisco, we have the University of California, San Francisco. We have a number of other hospitals. And the fact is, if we did absolutely nothing and there was a surge, we wouldn't have enough hospital beds, enough ICU rooms, enough ventilators to serve the population if we did absolutely nothing, which should alarm any mayor in any city.
You've said you have a hard time getting protective gear, and I've read that some of that was diverted to China. Who's seizing this? Why do you have a hard time getting it?
Well, there was a shipment that was on its way that we had purchased that was actually diverted from China to France. FEMA has the ability to confiscate some of the PPE at the border, which has occurred. It's been very difficult, and then sometimes getting things through customs or needing to use a ship rather than a plane. And so we have been resourceful. We are lucky to have incredible people like Mark Benioff, who has really helped to work with UCSF, University of California, San Francisco, to get PPE and to bring it to the hospital. And we've shared our resources with one another. But the fact is, this should be a federal coordinated effort. We should not still be having these conversations, which is a big reason why we have to put these shelter-in-place orders, because we don't have the resources that we need to keep people safe, especially around testing.
You know, one of the things we learned this week was that the CDC had confirmed that the first death from COVID-19 was actually far earlier and in a different place than had been previously reported. It was actually in the Bay Area, February 6th, where a woman passed away. What does that tell you? What do you know about how long this virus was actually circulating in your area?
Well, it gives us an indication. I know that the governor has asked to do more testing of people who passed away during earlier periods before we had cases, in order to determine whether or not they were COVID positive. In fact, one of our first cases of someone who passed away, who we declared as someone who passed away from COVID, actually passed away from a heart attack. And once we found out that their mom, who was in the same household, was diagnosed with COVID-19, we went back and tested this individual and discovered that they had it as well. So I think that it had been in the community for some time, but again, the lack of testing and resources available made it difficult to really get the facts around who had actually contracted COVID-19 before we started to announce the numbers.
There is a lot of travel from Asia into your region of the country. How much did the president's ban on travel from China benefit, and how much did it hurt that there wasn't a simultaneous one with Europe, that you had to wait for that?
Well, I'm not necessarily certain if that had an impact, because I will say that we were already focused on trying to prepare for what we expected would happen in San Francisco. We have been monitoring this situation since December of last year. We set in place a declaration of emergency back in February. We operated our emergency operations center because of those relationships between people who live in San Francisco and their relatives and their friends in various parts of China. And we had experienced, sadly, a lot of xenophobia against our Chinese community early on. I mean, basically, Chinatown was a ghost town in the month of January. And so we had been keeping an eye on this and making adjustments in order to prepare our city for what we knew was actually coming here. And I'm not certain really what so.
Okay. Thank you very much, Mayor, for joining us this morning and telling your story.
Thank you.
Joining us now from Westport, Connecticut is former FDA Commissioner Dr. Scott Gottlieb. Good morning to you.
Good morning.
What do you make of what the mayor described with this very early case of COVID-19, February the 6th? What does that shift of the timeline indicate to you?
Not much that we don't already know. We know there were imported cases on the West Coast early in sort of mid-January to late January. We know that from the work that's been done out of the hutch in Seattle from Trevor Bedford. So it's not surprising that there also were imported cases into parts of California. There was a lot of travel from China into that region. And the cases that got into the West Coast were probably cases from China that got in before the travel restrictions were put into place. And so it shows that they had earlier clusters, but it's not inconsistent with what we already assumed. The seeding on the East Coast seems to have been from Europe, mostly from Italy. The seeding on the West Coast seems to have been from China.
Are those different strains of the same virus?
There are different strains, and there appear to be two predominant strains here in the U.S. They're both on both the East Coast and the West Coast. Now, one strain predominates on the West Coast, one strain predominates on the East Coast. There's no reason at this time to believe that the different strains have different infectivity, different virulence, that one's more dangerous than the other. But that's something that's being looked at right now by people who are sequencing these strains and trying to correlate the sequences of the strains, the genetic profile of these strains, with outcomes to see if people that have one kind of strain are having worse outcomes or getting infected at higher rates.
Parts of the country are opening up. Georgia, getting a lot of attention for how much they've opened up and so quickly. What does that do to the rest of the country? Does it up the risk of infection?
It does up the risk of infection. Georgia's certainly not out of the woods. They're only testing about 1% of their total population. They have 23,000 cases. They may have plateaued in their epidemic, maybe, but they're still accruing a lot of new cases, and they certainly aren't coming down in terms of the number of new cases each day. The slope up in terms of cases that got us to the point of this epidemic was a rapid slope. It was a rapid progression up that epidemic curve. The slope down is going to be far more gradual. Now, in China, the slope down was symmetric with the slope up. It was a much more symmetrical epidemic curve. But in Italy, what you've seen is they rapidly grew the number of cases, and they're very slowly coming down. We're likely to look a lot more like Italy. So it's going to take some time until we see sustained declines in new cases and get to the point where there's a low enough level of spread in the country that we could feel comfortable about opening up parts of the country. It's going to be probably mid-May, maybe late May in parts of this nation. Georgia's certainly jumping the gun, I think, here, getting started too early relative to where they are in their epidemic.
I want to ask you about Rick Bright. He ran an agency, BARDA. People don't know that agency, but it was working on a vaccine. And he was pushed out of the job. He says he's going to file a whistleblower complaint and that this all stems back to some public or some concerns he had raised about the president's public touting of hydroxychloroquine. Do you think this personnel change-up has an impact on America's ability to quickly develop a vaccine?
It's hard to say it doesn't. I know Rick Bright well. I work closely with him. I testified alongside him before Congress. He was very effective in that role. We worked together on an Ebola vaccine and a treatment for smallpox. People knew him. I think it was important to have continuity in that job, and he was effective. He was a vaccine expert. So I was sorry to see him go. I think changing leadership in that position right now certainly is going to set us back. It's hard to argue that that's not going to have some impact on the continuity, and also make businesses, companies that need to collaborate with BARDA, a little bit more reluctant now to embrace BARDA, now that there's a cloud hanging over it and some uncertainty about the leadership. So I was really sorry to see that happen.
Well, what about the concerns regarding hydroxychloroquine? I mean, the FDA put out a warning this week that it could have a negative impact for your heart if you take it as a treatment. Should doctors continue to try it?
I don't think doctors should be using it outside of protocols at this point, given the fact that we've had now accruing evidence demonstrating really no benefit and some indication that it could be causing harm. I think it's still reasonable to conduct clinical studies with it to see if it could be effective as a treatment. But we've done a lot of clinical studies to date, and we haven't turned over a card that's really shown that the drug's effective. This was being used very widely in New York City and other cities as well. It was being used very widely in Italy also, off-label as a treatment initially in the setting of this outbreak here in the United States. I think a lot of doctors that I talk to in New York City are starting to pull back from using it right now, given the fact that they really haven't seen an indication that's having a robust treatment effect.
You're a doctor, you're a scientist. What was your reaction when you heard the president say he wants to explore using disinfectant on the lungs, quote, almost a cleaning of them? What did you think?
Well, look, this is a constant concern that people do try disinfectants as agents. There is a perception out there sometimes among some people that they could be effective. There's no effective use of a disinfectant internally, and we should be very clear about that. Nobody should be using a disinfectant as an ingested agent, injecting it, eating it in any fashion. These are deadly agents. We see thousands of calls to poison control each year around people who consume disinfectants. So we need to be very clear about this, that nobody should be consuming a disinfectant, and they don't work for the treatment of anything, let alone coronavirus.
So that's a fairly clear do not do this. Thank you.
That's right.
Dr. Gottlieb. We will be right back. We leave you with a look at our democracy and how during these troubled times we are increasingly looking to ourselves for leadership. America's two fundamental powers, as General Jim Mattis tells it, are inspiration and intimidation. But lately, the world has been left hungry for a strong dose of the first. America's being humbled by this invisible enemy. It is a stress test on our democracy. The virus exploits the cracks in our institutions, the social, economic, and racial disparities that define who is most vulnerable. The U.S. has the world's highest number of COVID-19 infections and reported deaths. The White House says that statistic does not reflect the large size of the U.S. population and the comparatively low 5.7% mortality rate.
We were at the top of the list in terms of success. Nobody wrote it. Nobody wrote it in terms of mortality. You saw that. Nobody wrote it.
But arguing over relative death rates seems at best morbid. More than half of Americans, 57%, say the U.S. effort to deal with coronavirus is going badly. And more than half think day-to-day life in this nation will be permanently changed, according to the latest CBS News poll. Images of the wealthiest country in the world facing overwhelmed hospital wards, food bank lines, and digging potters' graves is shocking for those who view America as an aspiration, one that has long boasted of its leading medical and technological research. South Korea has become the gold standard for public health. Massachusetts looked there for inspiration for its own contact tracing plan. German Chancellor Angela Merkel earned praise for keeping infection rates low. Perhaps her background as a scientist is what makes her so precise, a contrast to President Trump, who continues to push treatments that his own medical advisors reject.
I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Deborah, have you ever heard of that? The heat and the light relative to certain viruses, yes, but relative to this virus?
Not as a treatment. I mean, certainly fever is a good thing when you have a fever. It helps your body respond. But not as, I've not seen heat or light.
I think it's a great thing to look at. I mean, you know.
The call for global leadership has so far gone unanswered at the UN, and the U.S. froze funding to the World Health Organization. The leadership America needs may come from the ground up. From people like these Pennsylvania workers who labored for 28 straight days, even sleeping in the factory, in order to produce protective gear. From these Georgia business owners who are defying the governor's calls to reopen.
You can't bring people back to life, but you can start a business again.
Ultimately, it will be up to the American people to decide when they feel safe enough to emerge and to make the unthinkable calculation of what an acceptable death rate is. This crisis has helped us learn who really is essential in America: the grocers, caregivers, delivery men, janitors, electric grid operators, and of course, the heroic frontline healthcare workers. Their collective bravery is a reminder that the survival of this democracy may ultimately rest with we the people. We'll be right back. Earlier in this broadcast, I said the president had suggested potentially ingesting disinfectants. He suggested injecting disinfectants. That's it for us today. Thank you for watching. Until next week, for Face the Nation, I'm Margaret Brennan.